going to be discussing symphysis pubis dysfunction, or pain and instability that occurs at the symphysis pubis, which is right here, during pregnancy. Now, if there is instability to the point that the two halves of the pelvis are separated 10 millimeters, that's referred to as diastasis pubis symphysis. There's no clear consensus in the research regarding how frequently this occurs. Some studies say it happens 1 in 36 pregnancies. Other studies say it happens 1 in 300 pregnancies. So we really don't have a very clear picture on how frequently it occurs. When it does occur, treatment is aimed at restoring pelvic alignment as much as possible and decreasing pain. This can be accomplished through exercises to help stabilize the pelvis, such as core exercises and hip strengthening exercises. And it can also be accomplished through external supportive devices, such as the Sorolla belt or the Baby Belly and Belt by Diane Lee. In addition, physical therapy includes a lot of education on certain things to do and certain things not to do to help prevent pain from occurring. Some suggestions that patients find helpful are, for starters, log rolling out of bed, which is rolling out of bed. Imagine your body is a single unit and you're turning your knees to the side as well as your shoulders to the side. And then when you get out of bed, you're not twisting or rotating from the spine at all. You're pushing up from the arms while dropping the legs off the bed. We also recommend trying to get dressed while sitting rather than standing and picking up one leg while trying to get your leg in the pants, because what happens when that occurs, we call that reciprocal movement or reciprocal activities, is that it puts a lot of pressure on the symphysis pubis, and we want to try to avoid doing things like that. Another type of reciprocal activity that we would recommend avoiding would be cycling, because that isn't very user-friendly or fun for the symphysis pubis. In addition, we encourage patients to wear flat supportive shoes, to take rest breaks as needed, to try to keep your knees together and pivot while getting out of a car, rather than, again, this type of reciprocal activity where you're opening and widening at the hips, and that can put pressure on the symphysis pubis. In addition, we want to make sure that patients are not crossing one leg over the other, and that can also create pressure on the symphysis pubis.